Many people know someone with an artificial knee or hip joint, but shoulder replacement is less common. But it is just as successful in relieving joint pain, and Dr. Alan Saperstein is the chief of orthopedics at Boca Raton Regional Hospital. He is here to tell us much more. First of all, doctor, thank you for joining us.
Thanks for having me.
First question here is, what conditions can contribute to total shoulder replacements?
The most common reason people have shoulder replacement is osteoarthritis. Arthritis is a condition of the cartilage, the lining of the joint. In arthritis, it becomes worn down, and it can even be worn down to the underlying bone. This causes pain and restriction of motion and severely limits somebody's function in the shoulder.
Obviously leading to maybe a decision to get total shoulder replacement surgery. Can you tell us what happens during that type of surgery?
A shoulder replacement is really a resurfacing. What we do is we remove the diseased cartilage and bone, and we replace it with artificial parts. On the ball side, it's a metal ball. On the socket side, it's a plastic socket. And the metal and plastic glide one on another, reproducing smooth motion and getting rid of the pain that was associated with the arthritic joint.
You know, other than getting rid of that pain, I think a lot of people want to get back to a normal lifestyle. So how long does that take after a shoulder replacement surgery?
Well, the recovery from shoulder replacement proceeds in stages. The initial stages are healing of the wound, reduction of swelling and pain in the shoulder, and that goes on for the first week or two. The next stage is working on motion, and that usually takes about 6 to 8 weeks to get the motion back in the shoulder. Then the final stage is restoring strength to the shoulder, and that typically takes 3 or 4 months. All told, till you can return to full activities and you're done with everything, it's about 5 months.
Now, what type of things do you do during that rehab for a total shoulder replacement? I mean, it can be a lengthy process. You just said how long it takes, but what exactly are they doing there?
Well, a lot of it is with a physical therapist. They're working on exercises to move the shoulder and restore the range of motion, and of course later on restore the strength. But a lot of it's also done on your own. We have people use certain simple equipment around the house, little exercise bands to strengthen the shoulder, pulleys to restore motion, things that they can do on their own.
Quickly, I wanted to ask you, Boca Raton Regional Hospital has what's called reverse shoulder arthroplasty. Hope I'm pronouncing that one right.
Yes.
Tell me what that is and how it's different than a normal shoulder replacement.
Well, traditionally, the one group of patients that really couldn't have a shoulder replacement were those with a deficient rotator cuff. That's really a prerequisite to doing a shoulder replacement, or at least it was in the past. Now there's a new replacement that has a reverse geometry that compensates for the rotator cuff so that we can do a shoulder replacement on a patient who not only has severe arthritis but also has a deficient rotator cuff.
Okay, Dr. Saperstein, thank you for joining us on Boca Raton Regional Hospital. Sponsors our experts and underwrites our Ask the Doctor feature.